Hello viewers, you're welcome to another episode of You and Your Healthcare Provider that's brought to you by Initiative on Health Accountability and Transparency, a local NGO founded to promote good governance and accountability in the health sector. I am Dr. Adeyemi and I'll be speaking on patients' rights and responsibilities in the healthcare. One of the key functions of the health system is responsiveness to the needs and demands of the citizen. Responsiveness describes how well the health system meets the expectations of the citizens, often in the quality of services received, and how suitable or appropriate and timely in response. In other words, responsiveness refers to how timely a patient receives his treatment or her treatment, and the quality of care that was given to the patient, and how appropriate was the treatment appropriate for the diagnosis that was gotten. Everyone seeking or receiving healthcare has certain rights and responsibilities, and I am here to educate you on some of these rights and responsibilities, and they are often codified as the Patient's Bill of Rights. Our focus on this episode will be on the Patient's Bill of Rights, the importance of the Patient's Bill of Rights, and some specific patients' rights and responsibilities. Please know that a Patient's Bill of Rights is defined as a citizen's charter which provides the commitment to the services which will be provided by health institutions such as the hospitals and the other categories of health facilities. It is an aggregation of patients' rights that exist in other instruments, including the Constitution of the Federal Republic of Nigeria, the Federal Competition and Consumer Protection Commission Act, the Child Rights Act, the Freedom of Information Act, National Health Act, the Hippocratic Oath, and some other professional ethical codes and sundry regulations. The Patient's Bill of Rights is a list of guarantees for those receiving medical care, which clearly spells out the patient's right to information, urgent medical intervention. It secures a healthcare environment, and it's also the right to be treated with respect and timely access to medical records, which must be treated with confidentiality. It may take the form of a law or a non-abiding declaration. Typically, a Patient's Bill of Rights guarantees patients information, fair treatment, and autonomy over medical decisions, among other rights. The key elements are the right to respectful and considerate care, privacy, information about treatment, prognosis, and the right to refuse treatments. These are some of the key elements in the Patient's Bill of Rights. So now we'll be looking at why the Patient's Bill of Rights is important in healthcare. The Patient's Bill of Rights is a demand-side approach to making health service responsive to the desires and the demands of the citizens, and it clearly defines the levels of care which patients can expect from the health service providers. Please note that the Patient's Bill of Rights stresses 1. The importance of a strong relationship between patients and their healthcare providers. It also stresses the key role patients play in staying healthy by laying out rights and responsibilities for all patients and the healthcare providers. Please, we'll go on a short break, and when we come back, we'll be going into details in the content of the Patient's Bill of Rights. Please stay connected. Thank you. You're welcome back. So before the break, I told you we'll be going to the content of the Patient's Bill of Rights and Responsibilities. The indisputable rights include the following, but is not limited to these ones we'll be looking at. There's a right to relevant information in a language and manner the patient understands, including diagnosis, treatment, procedures, and the possible outcomes. So a patient has the right to know all about his or her diagnosis, all about his or her diseases, whatever he or she is suffering from. The patient has the right to know everything to the treatment that is being given. The patient also has the right of timely access to detailed and accurate medical records and available services. He has the right to transparent billing and full disclosure of costs or estimation of recommended treatment plan services. Before the treatment commences, the patient has the right to the transparent billing, to know everything that he or she will be billed for, the cost of all procedures that will be done, cost of all the tests, all the drugs he or she will be given. The patient has the right to transparent billing. He or she also has the right to privacy and confidentiality of all information and medical records, unless disclosure is vital and in the interest of public health in accordance with prevailing law. The patient has the right to clean, safe, and secure healthcare environment. A health facility has the responsibility of keeping the environment clean and safe for the treatment of any patient, so the patient can access clean and safe healthcare services. A patient has the right to be treated with respect and dignity without prejudice to gender, religion, race, ethnicity, allegation of crimes, geographical location, disability, or socioeconomic circumstances. Irrespective of the color of your skin, of your religion, of your tribe, or where you come from, everybody has the right to be treated with respect and dignity at the healthcare facilities. Every patient has the right to receive urgent, immediate, and sufficient intervention and care in the event of an emergency. In cases where a patient reports to an emergency or a relative brings the patient to the emergency unit, that patient has the right to urgent care without further questioning or waiting for deposits or whatever. The patient has the right to receive urgent and immediate care at the emergency unit. Every patient has the right to reasonable visitation in accordance with prevailing rules and regulations. Every patient also has a right to decline care upon full disclosure of the consequences of such decisions. As far as the person is an adult, he has the right to say, I don't want to receive this treatment. I don't want to have this management done on me, after the doctor has fully explained the consequences of such decisions to him or her. A patient has a right to decline or consent to participation in medical research, experimental procedures, or clinical trials. You know, in the hospitals we carry out medical researches to improve our management of patients and also for public health purposes. So a patient has the right to decline and say, I don't want to be part of this medical research. So no patient should be forced to be part of a medical research. They have a right to decline or consent to participation. A patient has the right to be informed about any impending interruption or disengagement of services of primary or attending professionals responsible for their care. In such events as maybe there's going to be a strike of the doctors or nurses or whatever association wants to go on strike, a patient has the right to be informed about the impending interruption or disengagement of their services. A patient has a right to quality care in accordance with prevailing standards. There are standards, professional standards that guide management of patients. So a patient has a right to quality care that are in accordance to those prevailing standards. A patient also has a right to express dissatisfaction regarding services and or against the service provider including personnel changes and abuse. That is, a patient has the right to complain. He has the right to say, I am not satisfied with this healthcare worker, I am not satisfied with the service of this hospital. The person has the right to express dissatisfaction to any through any channel he or she wants to use. Now let's look briefly at the patient responsibilities. These include, but not limited to: 1. Giving the healthcare provider accurate information about present complaints, past illnesses, hospitalizations, medications, and any other information about his or her health. A patient has the right to give the healthcare worker or the doctor in charge all information as regards him or her, all the medical history, whether present or past. The patient has the responsibility to give that healthcare provider accurate information. He also has the responsibility of reporting unexpected changes in his or her condition to the healthcare provider. Maybe he noticed something new about his case on the course of taking a particular treatment or medication. He has the responsibility of reporting that change to the healthcare provider. The patient also has the responsibility to report to the healthcare provider whether he or she understands a planned course of action and what is expected of him or her. Maybe he was supposed to come back for a procedure the next day, and he was informed, okay, you don't eat from so time so that the procedure can be carried out at a particular time the following day. If the patient doesn't understand what instruction was being passed to him or her, he has the responsibility to ask for more clarification of the things that are expected of him or her. Another responsibility of the patient is to follow the treatment plan that is recommended by the healthcare provider. It is not in the duty of the patient to say, no, I feel I'm using too much of this drug, I feel the dose is too much, let me reduce it, on his or her own volition. He's supposed to follow the treatment plan that is recommended by the healthcare provider, and if there are side effects or changes he is experiencing, he has the responsibility to report to the healthcare provider before he now changes the treatment plan. It goes to the healthcare provider, immediately he notices those changes and reports, not that he will just stop it on his own. The patient has the responsibility to keep appointments, and when unable to do so, he should notify the healthcare provider or facility. Whenever you are given an appointment, it's your responsibility to keep those appointments, because the management is being followed up. You are being monitored. You are on treatment, so monitoring is taking place. So whenever you are given appointments, it's the patient's responsibility to keep such appointments, and if he's not able to do so, he should notify the healthcare provider or the hospital. His or her actions: if treatment is refused, if the patient does not follow the healthcare provider's instructions, is responsible for his or her actions. Also, the patient's responsibility includes making sure financial responsibilities are carried out. Please, it's very important that the patient also carries out his financial responsibilities. That is, pay your bills. We have mentioned earlier that the patient has the right to transparent bill and full disclosure of everything that's going to be done for him or her. The provider has done that for you, has given you a transparent bill, and has done full disclosure of your treatment plan. It is now the patient's responsibility to ensure that they carry out their financial responsibilities. Also, every citizen has the right to get basic information on the patient's rights, and they also have the responsibility of following the healthcare facility conduct rules and regulations. These are some of the patient's responsibilities. The full details can be gotten in the full patient's bill of rights. Please note that it is important that patient's bill of rights has to be displayed at every facility where services are being provided. Every hospital is supposed to have like a charter, like a banner, or we say that has the patient's bill of rights conspicuously placed in their hospitals, that everybody can see. That is like the patient's charter. Also note that the information on patient's bill of rights is routinely disseminated to citizens through pamphlets, radio announcements, TV and newspapers, through the text messages and social networks in local languages. It is important for this information to be routinely disseminated to citizens. Also, institutions and civil society organizations can promote patients' rights by setting up complaints and petition platforms to aggregate patient grievances and engage relevant institutions. Now, let's look at the available channels for reporting complaints and grievances. A well-functioning healthcare system has to be accountable with clear mechanisms and channels for reporting and managing complaints and grievances. Where cases against the healthcare providers by the aggrieved patients or their relations can be investigated and sanctioned where necessary. That is, every healthcare system is supposed to have a channel or mechanism where a patient or the relatives can report any complaint or grievances, so that such things can be investigated and appropriate sanctions will be given to the erring healthcare worker. So some examples of channels which complaints and grievances can be reported through is the local administrative channels in the healthcare facilities. Here you can use the helplines. Each hospital will have dedicated lines through which patients can lay their complaints. They can have complaint boxes where you drop your complaints, dedicated complaints desks or officers. There are some facilities that have dedicated officers that receive complaints or inquiries about anything you want to do. So every hospital is supposed to have a Servicom desk that takes complaints. And you also have electronic or digital platforms such as emails where you can submit your complaints or grievances. Another channel is through the ministries, departments, and agencies. Patients and relatives can submit petitions to the following: to the employer. This is the authority where the professional is working, such as the Hospital Management Board, the state and the Federal Ministry of Health, and so on. Let's say the complaint is against a healthcare worker. So the patient can go higher to the Hospital Management Board, that is the employer of the healthcare worker, or even the state and the Federal Ministries of Health. Also, the complaints or the petitions can be submitted to the purchaser. This can be the health maintenance organizations, the HMOs, or the National Health Insurance Scheme, which is the NHIS. The other channel through which you can lay complaints are the Servicom agency. You can go directly to the Servicom office to lay your complaints. You can also go to the Federal Competition and Consumer Protection Commission, FCCPC. Also, the National Assembly has committees on public petitions in the office of the Senate floor or the House of Representatives. Complaints can be laid and committees on these public petitions can meet and sit on them. Another channel for complaint reporting are the professional or regulatory institutions or agencies. There are various professional agencies where patients and relatives can submit their petitions depending on the type of case. They include the Medical and Dental Council of Nigeria for complaints that are related to doctors, the Nursing and Midwifery Council of Nigeria for complaints related to nurses and midwives, the Pharmacists Council of Nigeria. These are for complaints or petitions that are related or concerns the pharmacists. You also have the Medical Laboratory Science Council of Nigeria. Health workers, the medical laboratory scientists, or anybody that you have a petition against in the laboratory setting, you can report that complaint or petition to the Medical Laboratory Council, Science Council of Nigeria. Also, if the healthcare worker is a community health practitioner, such complaints can be submitted to the Community Health Practitioners Registration Board of Nigeria. All these councils have investigative committees where all the petitions are investigated and thereafter they are referred to the professional disciplinary tribunal which has the status of a High Court of the Federal Republic of Nigeria, if necessary. Practitioners who appear before it, whether as complainants or defendants or witnesses or lawyers, must conduct themselves as they would before a High Court. Also, another channel through which you can submit petition is the regular courts. Complainants could sue providers directly in the regular court if they have sufficient evidence, but it is advisable to channel petitions through the professional regulatory institutions. In rounding up this episode, we are inviting you to partner with us to promote provider accountability in healthcare in Nigeria. We have various social media networks through which you can engage us. You can follow or engage us on our website. Here we provide value-added services to our friends, followers, and viewers. We have blogs, podcasts, publications to inform, educate, and communicate some important health tips and emergent health issues. We also have a learning management system, the LMS, known as the CPD Academy. This is an online self-study educational platform. On this platform, we train current and future health leaders and managers, and all those that are aspiring for leadership and management role in the health system, with basic leadership and management knowledge, skills, and competencies for effective leadership and governance. We're also on Facebook. Our Facebook handle is on the screen. On our Facebook page, we connect with friends, work colleagues, or people we don't even know online, and we share pictures, videos, and articles, as well as educative posts. We also stream live every Wednesday from 10 a.m. to broadcast our program, You and Your Healthcare Provider, which you are currently watching. Please endeavor to like and follow our page. We're also on Twitter. Our Twitter handle is also scrolling on the screen. We connect with people and share our thoughts. We also share important health tips and stories regarding trending news and events. Do follow us to like, retweet, and comment on any of our posts. We have a WhatsApp number through which you can send us text messages, share images and documents. You can also join our Health Consumer Forum by clicking on the WhatsApp icon on our Facebook page. Through that, you will be part of our community on the Health Consumers Forum, and you can share with us your healthcare experiences. We'll be closing today's episode with a short video on the Patient's Bill of Rights to further assist you in understanding this topic. Please join us same time next week for another episode of You and Your Healthcare Provider. Thank you for listening. Bye.